HA. So if you put HA, you mix it with DMSO or I'm giving all my secrets away. You mix it with this new carrier called lysosome. You rub it under, you need a little bit. You rub it under the eye. Within 5 to 10 minutes, because it drags water in, it just plumps it up. You ever see that on TV? You know, this night show, if you can't sleep like I can't, I watch this, they're trying to sell you all this stuff. I'm going, that's HA. It's so cheap. They put in a little squirt bottle. Wow, remarkable results before and after. It's HA. Then we have another stuff called MSM. MSM stands for methyl sulfonyl methane. You don't have to remember that, but it's very important and effective. It's found in fish, fruits, vegetables, seafood, and meats. Notice I always put meat last. Fruits and veggies have a lot of MSM. It's a sulfur compound that helps to repair the joint, especially the cartilage. It will dilate when you put MSM either in a gel directly on, or you eat it. You suddenly feel your joints very warm, because it improves the blood flow. That's what healing is. It aids healing. Celadrine. In the journals on joints, this is the only substance that people talk about amongst the doctors. I mean, doctors don't believe in anything, themselves. Everything else is a lie. But celadrine, this is medically proven. Celadrine is a cetylated fatty acid, which is found in bovine tallow, in the oil. It provides lubrication, and it gives you rapid relief, pain relief. It lubricates the joints, and is anti-inflammatory, and is an analgesic. Works very fast. So if you go and look up the journal, rheumatology and all that, there's published stuff on this stuff. And now we have this new stuff which I'm telling you, these little lysosomes are little tiny miniature sacs that will hold the stuff that you want to use, and you can put it on the skin, and it carries it through the skin. So now, if you have a fever, you have these things you put on the top of the head, contains Panadol, because they add this lysosome. It goes right in, it's like taking Panadol, especially for children. They put this with hormones, women who are suffering from menopause, or men. Don't talk about men because men don't believe in anything. So the women are the only one taking hormone replacement. Now it's transdermal. You just put some on the skin, that's all. Straight away it goes in. It works very fast because of this technology. It's called lysosome technology. This has been around 20 years. And other things that will carry it is a drug called DMSO. If you take some, you put in your fingers, within 2-3 minutes, you can taste it on your tongue. Tastes a bit like garlic, DMSO. Sometimes we use this to mix the stuff in so we can rub it on the joint. So you can use glucosamine. You can use all of this, celadrine. You can mix it with lysosome and rub it straight on. And plus take it. Very effective. Bone. This is where I talked a little bit about it before. You cannot talk about calcium in the same breath as osteoporosis. Doctors do, but they don't know anything about nutrition. This is so wrong. We have destroyed so many people by giving them elemental calcium. Calcium occurs most commonly in the rock. Calcium oxalate, calcium carbonate. And the majority of calcium in the market is cheap bone meal, which is calcium phosphate. They take the bone, the cow's bone, bleach it, clean it up, and they make it into powder, calcium phosphate. Oyster shell, eggshell. These are all forms of calcium, but this is not very good calcium. This calcium is difficult to dissolve, and when you do get it into your system, it deposits. Where? In your large vessels. It forms a plaque, causes coronary heart disease. So we are slowly, not all of us, we are changing to a different type of calcium. There's a red seaweed. And a lot of this work, of course, is done. A lot of research has already been done, which is high in calcium. And this form of soluble calcium is the one we are recommending for people and dogs and animals, because this really is soluble. It doesn't precipitate out, doesn't cause hardening of your vessels and all that. It also contains other essential minerals which are important for bone. And one of it is magnesium. But remember I talked, this is all useless if you're vitamin D deficient, which most of you are in this room. I look at you, I know. There are not 10 of you. There's not enough of you with tans on. You gotta take vitamin D. You must have a source of vitamin D. The important vitamin D is vitamin D3. You can buy that as a capsule, or you can buy it as a transdermal. You know that vitamin D? You can rub it on. It's get absorbed. Or for God's sake, go to the sun now. Forget about looking Asian. Genetically, we're Asian. We're not going to be Caucasian overnight. If we dye our hair blonde and our skin white, still makes you Asian. Contraindications, virtually none, unless you have allergies to it. You can be allergic to any of the things I've talked about. Glucosamine, shellfish extract, of course you can get allergic to it. Taurine is extract from meats. Celadrine is an extract from bovine tallow, from cows. Of course you can have allergies to this. You just got to make sure that the animal don't develop rashes and all. Coughing is one of them, asthma. But that's the only contraindication to the use, allergies. It's very important that you use, when you're using supplements, because you're using high amounts of it, over a long period of time, like me, 20 years of you better buy a good one. Because you don't even want small traces of mercury, lead, and all that. It's not going to kill you, but it's accumulative. After 20 years, you don't want to make sure your blood levels or your dog's blood levels of all of this is very high. Cause other diseases. Make sure it's pure. Of course, most people want, that's one thing I learned in Asia. Everybody wants cheap and good. There's no such thing. No such thing. Many herbs are contaminated at a point of growth from contaminated soil and water. So where they grow is important. So companies, responsible companies, make sure it's FDA approved. They've already done all the research. They've done the lab analysis. This doesn't contain, it's only got small amounts of lead, not enough to cause a problem. So this is very important. Same with chlorella. If you are one of those people that think that chlorella is like tiger balm, cures everything from carbuncle to cancer, then you better be careful how to take the chlorella. There's only one company, the Japanese company that harvests chlorella, I don't work for them by the way, that don't contain blue-green algae. Blue-green algae is a algae that looks like chlorella. And if you grow in the ponds, most chlorella is grown in Indonesia. It's an algae. You harvest it, you crush it, but if you don't check, if it contains blue-green algae, which is poisonous, it's going to cause a lot of problem. One of it is liver and kidney problem. If you take enough of it over a long period, you better make sure that this chlorella doesn't contain blue-green algae. Many herbs, animals are more susceptible to insecticides and aflatoxin, mold, the poison from mold, because of their smaller body weight and a higher metabolic rate. The only way to feed small animals, if you want no contamination, make sure the company is a reputable company. For example, if you feed your rabbit organic veggies, this will never happen. But if you eat it, of course nothing's going to happen. Not now. Maybe 20 years later, 10 years later, you develop something, but you don't relate the two. But animals, the lifespan is so short. They live their whole life in 10 years, or 5 years, or 2 years like hamsters. Everything you give them is concentrated in the very short lifespan. They are very sensitive. In fact, some people use animals as sentries. You know what a sentry is? As a guard. They feed them the stuff that they eat. Something happens to them, they know, I better not eat that. As I said before, the dose of any herb, nutraceutical, is 2 to 3 times higher than humans. Most are compatible with normal drugs. You don't have to worry about that. All the stuff I talked about is compatible. You can take drugs, you can take that at the same time. In fact, what you need to do, your drug dose sometimes had to go down because it's more effective. Made it more effective. Your hard drug dose, your joint drug dose. The only problem I face is giving it to cats because of the smell, not the taste. Cats, do you know, can't taste bitter. They're not like dogs. You give them bitter stuff, they can take it, but it's the smell that puts them off. So I usually open it, I mix it. I mix it with margarine or something good smelling like Melaleuca honey or that paste that we give to cats and dogs, that vitamin paste. Mix it with that, put it on, stick it on the mouth. Nutraceuticals actually work, and they're safe, And if you want to know research, there's so much research. You talk about double blind, and it's all been done already. Just that you don't read it or you've not heard about it, that's all. But it's all out there. All right, have a good day. Thank you.